Well, and I have to imagine there will be some overlap in terms of the maps that we are showing between my presentation and Nikki's. So I'm going to do just a little bit of an update on family planning and abortion in the state of Utah. So I hope that at this point, everyone is aware of the Ascent Center for Reproductive Health. We are a interdisciplinary center that's in the OBGYN department, but have partners all across campus. And have very committed to elevating the health and well-being of our community through essential sexual and reproductive health care, education, and advocacy. So lots of things going on there. So quickly, the majority of my presentation is going to be around the reproductive rights and reproductive health part of these circles, but I want to just introduce the framework of reproductive justice. So it's the idea that everyone has the human right to decide if and when to have a child, decide if and when if they will not have a child, and their options for preventing or ending a pregnancy, parent the children they already have with the necessary social supports and safe environments, and demand sexual autonomy and gender freedom for every human being. This is a framework that was created by a group of Black women in the South doing intersectional human rights work to expand the conversation and efforts beyond kind of the white feminist approach. So again, it's very intersectional, and I will just be talking about the health and legal part of it. So our team has done and big shout out to the whole team. A lot of these slides are drawn from my colleagues, and thank you. So our team has done these large-scale contraceptive access initiatives, in large part as demonstration projects for needs and policy changes that could be implemented here in the state of Utah. So the Her Salt Lake program provided over 7,000 individuals with contraceptive access, with no-cost contraceptive access, and followed them forward for 3 years to understand some of the individual level impacts of contraceptive access. Family Planning Elevated had a contraceptive access program that worked with health systems. And so we are able to really build this network of providers across the state who understand the importance of person-centered access to contraceptive care and become a resource with really strong connections to our team. And also we provided over 19,000 individuals with no-cost contraception. So some of the policy changes that have happened in some part based on the data that were collected during those projects, where we were able to educate and support Utah's Medicaid family planning waiver, which after a number of years of having lots of conversations and not getting passed, it was passed during the 2023 general session alongside extended postpartum coverage under Medicaid. So as of January of this year, anyone on pregnancy Medicaid, this does not apply to emergency Medicaid, but pregnancy Medicaid can have 12 months of continuous coverage postpartum. So that's already in effect. The part where contraceptive services and family planning services are covered were filed under a different waiver, and so are currently waiting for federal CMS approval, but we're hearing that summer 2024 is kind of the sweet spot. But Ascent is committed to providing implementation support to our clinical partners and is working closely with the Medicaid program. So family planning services that will be covered for anyone up to 185% federal poverty under this waiver program include family planning visits, FDA approved all methods of contraception, as well as STI-related care, contraceptive management, patient education and counseling, testing, and then all of these services are exempt from cost sharing. So apart from the policy changes, we've had a lot of programmatic expansion that's happened around contraception in Utah and with our program. So we've done quite a bit of community-based EC expansion, emergency contraception expansion. So currently in Utah, pharmacists are able to provide and dispense contraceptive, any self-administered hormonal contraception. EC has long time been over the counter, especially, or levonorgestrel emergency contraception has been over the counter. And so we've been working with those over the counter methods and our community partner organizations across the state and have dispensed over 2,500 doses. And then another exciting piece of this EC expansion project is campus access. So at the U, we actually have 2 vending machines, and the availability of EC is expanded through the vending machine program, and people can access that with their U card. It is for folks over 18 years of age, but EC is available over the counter for regardless of age and through community partners, regardless of age. But because we're at a state-funded institution, that age requirement is there. And through the University of Utah Pharmacy. So across 16 pharmacies, we're providing no-cost emergency contraception and no visit requirements. So through a standing order that's been made, you have the ability to request no-cost emergency contraception through MyChart, or you can have someone walk into a pharmacy and request no-cost contraception. So other contraceptive resources I saw there was a poster for the rapid access contraceptive clinics, which is great. And then our team is continuing to do training and technical assistance. We have our annual contraception education program happening in November. So save the date. So now I'm going to get into a little bit of abortion. Conversation around abortion policy. So as I'm sure you are aware, in June of 2022, the U.S. Supreme Court overturned Roe versus Wade, which returned the ability for states to decide the legality of abortion individually. So nationally, abortion volume was actually higher in 2023 than in 2022. And this has been captured through a number of different data collection, but We Count is a kind of real-time ongoing report, and they just put out their 6th report. And so we're able to see kind of which states are changing in volume. And as you would expect, states that lost legal status of abortion, the volume decreased significantly. And those neighboring states where people were accessing, we saw a volume increase. And so everyone, no matter where you live, has been affected by this. 14 states had total abortion bans for the majority of the 18 months since Dobbs. And most recently, Florida's 6-week ban went into effect. So Utah, this is our legislative timeline around abortion since 2019. So there's been a lot of activity. And I'm going to just highlight the current standing of abortion in Utah is that people can receive abortion care in Utah for any reason until 18 weeks gestational age, and then after 18 weeks with limited exceptions. And this is because there is a current injunction that is kind of we're a holdout, right? We had a trigger law that went into effect in 2020, or that was passed in 2020, so that when Roe fell, the state was able to say, okay, the trigger goes into effect, abortion's illegal. That was only the reality for about a day, and then the injunction went into place. And so there was also a clinic ban that passed, which delicensed any clinics, which the majority, 95% of abortion care happens outside of hospital settings. And that ban was also enjoined during that same hearing. And then in 2024, they actually repealed that because the legislators felt that it was complicating the Supreme Court's decision and delaying it. So we have 2 potential outcomes. We are in a very watchful time. The Supreme Court oral arguments in the state were heard August 8th. It was right after the boundaries, the redistricting was heard. And so we're waiting on any sort of decision to come out. But there's 2 potential options. Abortion remains illegal in the state. It's found to be unconstitutional. This will likely result in a challenge by the state legislators to change the Constitution in a future legislative session. And then the other option is that abortion becomes illegal. And this will likely result in a citizen initiative or ballot initiative to protect abortion access. Either way, it's a very tenuous space. And it's just important to kind of stay vigilant. And so the ways that we are doing that, we have a post-row task force within the university that was actually sparked during a COE symposium 2 years back, right after the leaked draft opinion came out, when Lisa Harris, who joined us as a keynote speaker, and was able to kind of help our group flesh out what it meant to hold accountability, to make sure that we are documenting both harms and potential impacts, and to be prepared for this. So our operational subcommittees include clinical care, clinical education and training, campus community, public education, communication and engagement, data collection, legal guidance, and provider advocacy. So the areas of university support that we have really focused on over the last few years include we're still continuing to work toward university-funded statewide or university-supported statewide no-cost contraceptive access initiatives. A clear commitment that the institutional will support trainees, support for all U of U employees in accessing the care that they need, commitment to train medical students, and then support on the Hill and with these policy conversations, and continuing to make sure that we're supporting policy through research and education. I also want to highlight some examples of the great research that's going on. Our second-year fellow, Alex Woodcock, conducted a study looking at the effects of the Dobbs decision on OBGYN graduating residents and where they were planning on going. And so, unsurprising, graduating OB residents report a decreased desire to practice or pursue fellowships in states with abortion bans. And then acknowledging that there is this risk of these types of extreme policies impacting maternity care and wait times and things that impact everyone. Our team also did a landscape analysis to see, especially when the policy to move all abortion-related care into hospitals came out, to see if hospitals were prepared to take on this additional charge. And we followed the methodology, or we followed kind of the lead of this group in Oklahoma, and found that, unsurprisingly, our hospitals were not prepared, and there was a lot of uncertainty around if and when and how they would be able to provide care for obstetric emergency and urgent situations. The good thing was, unlike our neighbors in Idaho, our hospital settings were prepared and understood that ectopic treatment was covered and protected, but they had in other more complicated vignettes, there was a lot more uncertainty. So one of the things that's coming down the pipe is our group has a research and implementation program that we're quoting Access Elevated, but it's committed to the sustainable abortion care environment. So it operates within 8 research and programming components that map onto the sustainable ecosystem, and really to the end goal of, regardless of the legal status of abortion in Utah, we want our research and implementation to support resilient local stakeholders and systems that are actively accountable and committed to comprehensive reproductive health care. So some other ways to stay involved and get engaged. We have, if this QR code goes to our provider network, which our fellow in the maternal fetal medicine program has been helping do a regular newsletter to keep providers updated. And then the VPR research working group has been on reproductive health is being developed, and we actually have a strategic planning event on May 23rd. So I invite any of you who are interested in doing this type of research to join us. And then the Scholar Strategy Network, we have a great Utah chapter that is working with national Scholar Strategy Network to kind of bridge that gap between academic scholars and policy engagement and helping us navigate some of those complexities and confusions that maybe come out of being an employee at the university. And then finally, I would like to direct you to the Ascent website, where we really try to keep up-to-date information and resources. We have put together these dot phrases on abortion access. So if you ever have patients or there's a provider one, if you want information for yourself, you can access those there, and it gives you up-to-date kind of real-time information on what's going on and what other resources are. So thank you so much. I appreciate the time and happy to chat more.
Thank you, Dr. Mihalopoulos and Dr. Sanders. In the interest of time, if any of you have questions for either of them, they'll be around, and please feel free to talk to them. Let's take a 20-minute break, but please vote on the posters. I have to confess, I didn't realize until just moments ago that there, besides moving things around on that Qualtrics thing, there's apparently an arrow at the bottom that I have to find, you all have to find, and we have to push, because just moving things around doesn't count. Got to hit submit. So please visit the posters. Please be back here at 5 minutes until 4, and please hit the submit button.